Welcome to our program. My name is Dr. Frankel, and as a board-certified emergency physician, I've seen a disturbing trend over the years. What we've found is that more and more patients come in with longer and longer medications lists, and the longer the medications list seems to correspond to the number of times that they show up in the emergency room. To me, this seemed to be a problem. This is what led me to my fellowship in anti-aging and regenerative medicine. We look at patients differently with this type of medicine. In the early 20th century, smart men and women saw that there was a problem with infections. They looked at the problem and looked for the cause of the problem. Today, things like TB, whooping cough, polio, no longer are present or in very small amounts. And the reason is because these smart men and women saw the problem and they went to look for the cause of the problem. Today, our problems are very different. Most of the problems that we see today include things like high blood pressure, heart disease, diabetes, cancer, and most of these problems are caused by some form of metabolic derangement. However, medicine today is very different. Medicine today is symptoms-based, which means that for every symptom you have, you get a pill to get rid of that symptom. And once that pill causes another symptom or a side effect, you need to take another medication to fix that problem. This circular pattern never seems to get to the cause of the problem. This is why we developed this educational program called the Metabolic Matrix. We believe that this is going to be a template for the 21st century of medicine to look for the cause of the problem and find the solutions. Hormonal imbalance, nutritional deficiencies, weight control, diet, environmental toxins, all have a role to play in these metabolic derangements that cause the problems. We are going to look for the solutions to these problems by looking at the most cutting-edge data that has been done at places like Harvard, Baylor, and UCLA. Our first episode is going to be on men's health and how your hormonal changes affect your overall health. Many people hear about testosterone affecting your lean body mass, energy, sexual function, but what makes me most interested in testosterone and hormone replacement in men is the incredible positive medical and health effects that testosterone has. Many of the studies that have been done in Harvard University and Baylor University have found that things such as Alzheimer's disease, heart disease, blood pressure, and diabetes are all affected positively by taking testosterone. Testosterone is a hormone that's created within the testes. It's controlled by the pituitary gland in the brain. The important effects of testosterone are as follows. In the brain, Alzheimer's disease is linked to low testosterone. Increased muscle size and strength are all affected positively by testosterone. Testosterone also reduces body fat, and mostly in the gut. It also prevents osteoporosis, and it has a decreased risk of heart disease when people are on testosterone. Andropause. Andropause is what we call male menopause. Some people call it menopause. It does exist. It affects approximately 25 million men between the ages of 35 to 55. And andropause is caused by low testosterone levels. The effects, as you can see on the slide, include increased belly fat, decreased mental sharpness, low libido, depression, sleep problems, irritability, muscle loss, and erectile dysfunction. This slide, linked to estrogen, is a very important slide because we have to understand that testosterone, which of course is the male hormone, is greatly linked to estrogen in the male body. So men do have estrogen in their system, and the fact is that sometimes your testosterone will lower and you will increase your estrogen levels. So as you can see, things such as on this list, belly fat, low vitamin D, alcohol, stress, increased stress hormone, and high insulin can all convert your testosterone into estrogen. And the reason why this is important is that when you have elevated estrogen levels, and sometimes estrogen levels are caused by abdominal fat, which often is caused originally by low testosterone. When you have low testosterone, you increase your abdominal fat because you decrease your lean body mass. So when you have abdominal fat, you increase estrogen. And what we're finding now in the current research is that estrogen is actually the cause of prostate cancer and not testosterone. And we're going to talk a lot about that in the upcoming slides. But if you have increased abdominal fat, you're actually increasing your estrogen, which is even lowering your testosterone even more. So this is a vicious cycle. The vicious cycle is when you have low testosterone, it's going to increase your body fat, which decreases your muscle mass, which in turn produces more estrogen. And when you have more estrogen, it's going to ultimately, again, decrease your testosterone even more. So this cycle produces more and more problems, but more importantly, when you have high estrogen levels, again, you're increasing your risk of diabetes, cancer, and heart disease. And lower testosterone does all these things. Insulin resistance is another important thing that we need to talk about. Insulin is the hormone that breaks down carbohydrates. And if your body starts to have difficulty breaking down carbohydrates, it often is because your insulin is trying to break down the carbohydrates, but your receptors of your insulin receptors are starting to malfunction. When this occurs, more and more insulin is being produced. And the reason why this is a problem, this does a few things. It shifts your body to causing increased fat deposition in your system. So it's actually increasing fat production in your abdominal system, as well as it's going to increase your risk of developing diabetes. As you can see on this slide, basically you eat some food, your body takes in the food and it takes in the sugar. Your pancreas is supposed to increase the insulin that's produced. Now when you look at the bottom of the slide, you can see the sugar needs to be broken down by the insulin. But what happens when people have insulin resistance, there's more and more insulin being produced. And so what eventually happens is that your body thinks that you're starving because of the fact that insulin will eventually make you hypoglycemic. So it actually makes you decide to eat more, and that increases the amount of sugar you have in your system, and eventually it causes you to have heart disease as well. Effects of high insulin do a few things. It increases your risk of diabetes. It causes cholesterol to develop into plaques, which we'll talk about. The plaques, of course, cause heart disease and heart attacks. It increases fat deposition in your abdomen, which of course, which we talked about, increases your development of estrogen. And it produces estrogen and lowers your testosterone, which also increases your risk of prostate cancer. So all these effects that insulin has are very important to understand. And unless you're getting your insulin checked by your doctor, you won't know that this is the case. And most doctors don't check insulin levels. So here's some studies that I'm going to talk about. Alzheimer's disease was studied in the University of Hong Kong. What they found is they found 153 men who were diagnosed as pre-Alzheimer's disease, meaning that they were not fully had the disease, but they were about to. So with these men, they also found that these men also had low testosterone. What they did was they gave all of these men testosterone. And out of the 153 that got testosterone, only 10 developed full-blown Alzheimer's disease. Another study was done in Wayne State University in 2004, and what they found is that there's a 26% decrease in the development of Alzheimer's disease with a 50% increase in testosterone, meaning that if you increase your testosterone by 50%, the risk of developing Alzheimer's disease goes down almost 26%, which is an amazing study. And now we want to talk a little bit about something that you might have heard about, and some of your doctors might even talk about: prostate cancer and testosterone. Often the dogma that was produced in medical school, in fact, was that testosterone causes prostate cancer. So if you take testosterone, you are putting yourself at a higher risk of prostate cancer. A Harvard urologist looked into this study, and what he did was he found men who actually had latent prostate cancer that it wasn't going to treat, but just enough to be aware of it. And he told the people that he was concerned because of the fact that testosterone causes prostate cancer, or so to speak. So he started giving these men testosterone and doing biopsies every few months. And what he found is that the cancer cells actually remissed, went down, and none of them developed prostate cancer. So he decided to go into the research and try to sort out where the research shows the link between prostate cancer and testosterone. So the number of studies that were produced that he found that linked prostate cancer and testosterone equaled 0. There was not a single study that linked prostate cancer and elevated testosterone. The reason why this whole dogma came about was in the 1940s, a man who was castrated received testosterone, a single patient. And at that time, there weren't advanced testings. He had developed prostate cancer, which metastasized. Now, we don't know if he had that prior, but the entire dogma of prostate cancer and testosterone is based on a single patient in 1940. No other studies have ever linked the two. And in fact, when you think about it, who develops prostate cancer? Older people with low testosterone. And so Dr. Morgenthaler, who's a Harvard urologist, decided to look at patients who were having prostate cancer. And what he found is that the men who are having prostate cancer actually have lower testosterone. His research is not done, but all the research points at this point that prostate cancer is not caused by testosterone, but in fact protective. So basically this slide shows that there was no increased risk of cancer with testosterone. And there was one study that showed that only the one study showed that the patient who had low testosterone had an increased risk of cancer was by that single patient. So what the conclusions are, as you can see, that there is now a greater link to an increase in estrogen in men to prostate cancer than testosterone, which makes total sense. What we talked about is when men decrease their testosterone, they increase their estrogen, which is actually the link to prostate cancer. Next slide, we're going to talk about heart health and cardiovascular health. There were two recent studies that were done. And in 2011, there was a study done that was published in the Journal of Cardiology. And they found that men who had received testosterone replacement had a decreased risk of cardiac death. A Rotterdam study showed that there was the highest percentage of heart plaques occur in men with low testosterone. And the third study showed that testosterone gel actually reduced angina in men. So there has been now multiple more studies that are proving that low testosterone is greatly related to heart disease and cardiac death. The next slide, we're going to talk about that 50% of patients who have a heart attack actually have normal cholesterol levels. And as you can see on this slide, that's the case. and it's documented. The problem seems to be that it's not the total cholesterol or just the LDL, bad cholesterol, that's the problem. But actually, we need to look at the small particle cholesterols. I know this might seem a little confusing because no one tests for it. But the facts are that they found that small particle cholesterol is actually the greatest detector of heart disease. And this is the reason why we are finding that almost 50% of men and women have normal cholesterol and yet are developing heart attacks. So on this slide, you can see clearly, this is two types of patients. Both of these patients will have a normal cholesterol level. Both of these patients will have a clean bill of health from their doctor, but both of these patients are not at the same risk. The patient on the right side with the small particle LDLs are at a much higher risk of developing a heart attack, even though his total cholesterol is normal. The patient on the left side that has large particles are not nearly at the same risk of heart disease. In fact, they have low risk of heart disease. So just looking at the cholesterol numbers doesn't give you the whole picture. High blood pressure, another major problem that we have. And what we found is that when you evaluate high blood pressure, it's important to understand that there are different types of high blood pressure. And it's important to test the metabolic test to really decide what type of blood pressure problem you have. Not to get too technical, there are two types of classifications that we deal with blood pressure. And some of the blood pressure has to do with a lot of blood in your system, and some of it has to do with low blood in your system. High renin and low renin are the technical terms for it. Certain nutritional deficiencies also contribute to blood pressure problems. Our programs that we do try to look for the nutritional deficiencies, look for the exact cause of your blood pressure, and we try to convert people from medication for the rest of their life to nutritional changes which actually get them off medicine for the rest of their life and actually stop the risk of having heart disease and strokes and other problems that occur with high blood pressure. So this is just a fun slide, and what a lot of people talk about is the negative connotations in a lot of the sports media about testosterone, steroids, things like that. Now, testosterone is a steroid, but the steroids you hear about on the news media about the baseball players taking is much different. They're designer steroids. They're at 20 times the potency of what we would give as a normal testosterone dose. So when you hear about the steroids that baseball players and football players taking, this is not what we're discussing. We're discussing natural testosterone replacement, something your body is missing that we're replacing. So it's vital that we know the levels of your testosterone. And when we start hormone replacement, it's important that we know your levels and we track them on a regular basis to make sure that you are getting the right dose and you're getting the amount that is going to be protective of all things like heart disease, Alzheimer's disease, but also gives you the positive benefits of all the benefits of testosterone. So common preparations with testosterone include injections, creams, and then there's other types of therapies that is not testosterone, but they actually produce testosterone. These preparations include HCG and Clomid. Every patient is specifically evaluated for what is best for them. No one gets the same treatment because everybody's different. Every individual we have to look at on a regular basis. So the testosterone benefits, as you can see, increased libido, increased lean body mass, increased erection time and intensity, reduces belly fat, increases mental clarity and memory, improves your sense of well-being and competitive edge. Most of my patients say they have a much better memory, they feel better about themselves, and they now are performing much better at work every day. The evaluation is a process where we look at all of your hormones and how they all relate to each other. So we look at things like your blood, and sometimes your urine, saliva sometimes, and we customize the plan that's appropriate for your particular problem. Sometimes patients need higher doses of testosterone, sometimes they don't need testosterone at all. But we need to find out what is the cause of your symptoms and what we can do to prevent future diseases and future problems that you have in the past. So it's important to understand when we talk about your health, hormone replacement is just not about sex and your libido. The positive effects of testosterone include decreasing your risk of heart attacks, decreasing your risk of developing Alzheimer's disease, decreasing your fat deposits and increasing your lean body mass, decreasing your blood pressure, decreasing your cholesterol, and decreasing levels of cancer, certain types of cancer. So again, your hormones are not all about what you might hear on the radio every day. What I'm most interested in is the positive medical effects that you have on a daily basis due to your elevated and improved testosterone levels.